Consumer robotics had a watershed moment just a few days ago when Autom, the robot weight loss coach, was launched at Dublin Web Summit. I'm very excited to open our Robot Startup series with an interview with Dr Cory Kidd, the founder of Intuitive Automata and maker of Autom, which is now being produced by PCH International. Autom was originally Cory's PhD research at MIT, which he then moved to an accelerator in Hong Kong. Most recently, Cory has been travelling the globe to secure Autom's Series A funding, and as a Robot Launchpad startup, Cory has offered to share his experience of the gruelling process from prototype to production. This interview was recorded just before Autom's funding was finalised. Welcome, Cory. Would you introduce us to Autom today and describe some of the changes since leaving the lab?
Certainly. Thanks for having me. Giving us a chance to talk about Autom here. So, Autom is a weight loss coach, which is the first product that we're bringing to market. The focus of what we're doing is on long-term behavior change. So the background research when I was at the MIT Media Lab showed how a robot was very effective at doing something like this, more so than doing something on the screen. That really was the proof of concept of what we've done in the last 5 years since leaving the lab. So there were a lot of theories that were developed. There was an implementation of Autom that time, which was a hand-built set of robots and software that was put together relatively quickly. Since then, we've taken those concepts, the core algorithms and the theories behind what has become the Autom product and created a new product from scratch. So all of the hardware, all of the software has been developed at Intuitive Automata. And is entirely new since leaving the Media Lab.
What are some of the challenges that you've faced moving from the research lab to running a company?
There are a lot of challenges. Part of it is, as a small startup company, just managing to do everything. So it's not only the product, which, when I was a student, I could really focus on creating the technology, understanding how users would interact with it. And in terms of the company, it's developing the product, it's finding the funding in order to do that development, it's working with customers, working with investors, really having to focus on every aspect of it. And there are, of course, challenges with each of those, but I think the big overall challenge is how you manage, particularly in the first years of a company while it's a small team, how you manage to get all of those done as best as possible.
Would you describe what's been the most useful tool that you've had? Is it something in a process, in business methodology?
Tool in terms of developing the product or developing the company. There are, of course, a lot of aspects to that question, I think.
Have you taken anything from the business or startup world that has been particularly useful for you?
I think a lot of things. We are developing hardware, which is today finally becoming a little bit more common again. When we started the company 4 years ago, it was definitely not so common, and that was a challenge in terms of not having a big community of people to work with around developing hardware products. And so there were some things we kind of had to figure out for ourselves, but at the same time, myself and Bill McCord, my main co-founder, come from a software background. So certainly developing using software development methodologies in terms of lean development, keeping a small team, iterating quickly, getting things in front of people as quickly as possible, which is, of course, a challenge when you're doing hardware. It's not as quick and easy to put together a prototype of a hardware product. So we've kind of developed the software that runs on this hardware and have been able to test it both on the hardware as well as using more traditional software testing methods, both in terms of looking at testing in the software development process as well as user testing. So trying to find ways to get it in front of as many people as quickly as possible.
Would you like to elaborate a little bit more about some of the ways you've gotten Autom in front of people as quickly as possible without necessarily having the hardware, or perhaps some of the other tricks for making the hardware do some of the things that maybe it's not yet doing?
Yeah, so we've done a few things over the last several years, starting from paper mock-ups, so the screen that would show up on Autom and, cardboard version of the robot, was really the early stages. So being able to, show those to people either, on a screen or actually, paper printouts that we could flip through. Some of those went, on a whiteboard for us to think about the conversation. So she's talking to people, and there's so many different things she can say. Being able to mock up a conversational flow. And so that was something that we developed internally, but then also started trying to put in front of other people as quickly as possible. So the robot itself is based on Google Android. So one thing that we've been able to do in the last 6 months is, Google Android tablets are now much more readily available. So it's a product that's new to the market in terms of the life cycle of development of the robot. So that's something that in recent months has allowed us to run the software on there and get that in front of people while we're still getting the hardware into production. So we have one prototype of Autom right now that we're using to show to people to demonstrate how she works, and then running the software on tablets so that we can use it every day and expand the number of people that we can get to use it on a regular basis.
How have you developed your metrics for feedback when you've taken things to people? What kind of information have you looked for?
We look at a number of different things. Some of it is just very simple. Do people understand what's going on, how to use it, how to respond to it, and looking at what sort of feedback they give. So that's very high level sort of user testing, and so we've gone from that sort of thing where we're putting the software in front of people, seeing if they can use it, or giving a tablet to someone with little to no instruction, much the way that someone would have the robot delivered to them, to kind of the other extreme are the studies I did at MIT and at Boston University Medical Center, looking very much at psychological responses to the software as well as behavioral responses to the whole system. So actually giving people robots in their homes, trying to understand how often they use them, how much time they spent with them, what the conversation was like, to the psychological measures of understanding what sort of relationship was developed, between the person and the robot, how well they were doing versus the goals they had set for themselves. A number of different measures that we explored there. So there's a wide range of things that we look at. A lot of metrics that are borrowed from psychology that we use in human-robot interaction, as well as user testing, user experience aspects that are borrowed from human-computer interaction. So I think there are a number of things that are quite important when it comes to looking at how people interact with a robot and why.
It sounds as though you've had to cover quite a few fields. Have you built out your team to factor that in, or has this been a really big learning curve for you personally?
We're just starting the process of really building out from the core team right now, and that we will be doing over the next 6 to 12 months. The advantage I think that we have is this is what I have done my master's and PhD work on. So I've had the opportunity, on the academic side of things, to really understand and develop a lot of these methods for testing. And then, as I mentioned, myself and one of my co-founders have software development background. So certainly understand at least some of the HCI processes that we've been able to use in this as well.
Now, I've heard that a VC told you that Autom was too much of a robot for them and that they'd fund you if you made a phone app instead. Yet,
I've certainly heard that one more than once, yes.
Obviously, there's a lot of value in Autom's intelligence. Why did you stick with an embodied robot? And what value does the physical hardware add?
Well, I think the best way to answer that question is just by talking about some of the background research. So I've been working at the intersection of technology and healthcare for about 13 or 14 years now. When I went back to grad school a little over a decade ago, I started with working with interactive robots, but took kind of a fresh perspective from them, not looking at them for any particular application, but trying to understand the basic psychology behind why people interact with robots and what's happening during that interaction. And in general, those studies took the form of looking at people interacting with a physical robot or people interacting with a character on a screen that was designed to look similar. And what we saw overall were two major differences. So one is that a robot is more engaging. But more importantly, once someone is engaged, that engagement lasts for a much longer period of time versus doing the same thing with an agent on the screen. And the other thing that we saw was when you're trying to convey information to someone, the information is seen as more credible and more informative when it's coming from a physical thing versus an identical looking character on a screen in the same voice. And what we know is this actually parallels what we've learned about human interaction. So when we're face to face with someone, we find that person more credible, more believable, more trustworthy. We're more likely to remain engaged with them than doing the same thing over Skype as we are now, or over the phone, or some other mediated form of communication. It's the same reason that I spend a lot of my time on the road. So as you mentioned, we're based in Hong Kong, but I spend about half my time in the US with customers, investors, and partners. That face-to-face interaction just makes a real difference. And so, looking at those basic psychological studies of people interacting with robots, I looked at the broad healthcare application of that being that of behavior change. So behavior change is about helping convince someone of something, but then more importantly, getting them to stick with whatever that change is over a long period of time. And what I saw from these basic studies was that doing that with a physical robot was much more effective than doing the same thing on a screen, be that a laptop, a tablet, a phone. There's something about that physical presence that makes a real difference. So for the applications that we're building, starting with our weight loss coach, but moving in towards more medically focused applications around chronic disease management or medication adherence, a lot of other health-related applications that we're working towards. When we look at those, the efficacy is obviously very important. And we've seen that having that physical robot is much more effective over the long term than doing the exact same thing on a mobile phone or a tablet or a laptop. So there's a real psychological and medical reason for using the robotic interface as opposed to doing the same thing purely in software.
So you see a future for medical technology or health tech is really in embodied devices and interactions with those devices.
Well, I think for certain health-related applications, so again, it comes down to, for us, looking at behavior change applications where one of the big challenges is, if I'm trying to make a change, to be able to really stick with it over time. One thing we know about, ourselves as people is we tend to be great at making changes and absolutely terrible at sticking with them. This is a great thing to talk about around February 1st when we've all just broken our New Year's resolutions, right? So they typically last 3 to 4 weeks. It's pretty short-lived. But having that coach, that social support in the form of a physical agent actually makes a big difference in helping me stick with something I'm trying to do. So that's the type of application that we're working on. Obviously, there are a lot of other healthcare related challenges. I think some of them are very amenable to this kind of technology, and some of them there are probably other approaches, either using technology or people, that might be more effective. So we really look at where this technology is effective and try to apply it there.
Okay, now you mentioned that you're based in Hong Kong now, but you're traveling around the States quite a lot, quite frequently. Yes. Would you like to elaborate on the journey that led you to Hong Kong, and if you've got any tips for other startups who might be in the same position?
Sure. So when we were setting up the company 5 years ago, we looked at staying in Boston, where I was at the time. I looked at coming to Silicon Valley, a few other places. Evaluated a few places around Asia as well. Hong Kong was attractive to us for a couple of reasons. One is the proximity to manufacturing. So being able to work with factories, electronic vendors, to be able to produce first a prototype and now the product relatively quickly, inexpensively, and high quality. There was certainly an advantage to being there. The rest of it's largely economic. Just the cost of doing business in Hong Kong is very attractive. The government has made a lot of effort over the last decade or more in attracting new technology companies. So we've been able to take advantage of that by initially we were in an incubation program, a 3-year incubation program when we first arrived. And then an interest-free loan from the Hong Kong government. So kind of take all the economic factors together, and we've been able to take the company much further on much less outside capital than I think we would have been able to do pretty much anywhere else.
Is that something that you think might be changing in terms of investment in robotics in America?
Potentially. I think we're seeing one trend I've seen this year for the first time in the last several years is that there's certainly more interest in hardware. What I've seen so far is that there's a lot more talk than investments, but it's certainly moving in the right direction. We are seeing investments made in this area, both hardware in general and robotics more specifically. have started to become more attractive to investors. And I think the consumer robotics industry is finally starting to emerge. There are a few companies that have been around for several years, a few success cases out there, a lot more companies that are being formed or still in the early stages that are starting to bring products to market. So I think it's a tremendously exciting time for this industry overall.
So what's next for you and Autom?
Well, right now we are really focused on getting Autom into production. So our first customers are in the US as the first market where we're working. So most of our customers right now are health insurers, hospitals, and employers. So looking at adding our Autom technology into existing weight loss or wellness programs. We're also doing some limited direct sales through our myautom.com website. But again, the focus is more on the institutional customers to start. We've been focused on finding the right partners to work with for bringing the product to market. So in the next 6 months, we're going into manufacturing. We'll start delivering the first products to customers that we've committed to, starting a number of trials with some of our large customers, and looking forward to starting to ramp up production in 2013.
Well, that sounds fantastic, and I wish you luck with that.
Thank you.
Is there any final take-home message for other robotics startups?
I think it's like I was just saying, it's a very exciting time to be in this industry. For me, it's the combination of robotics and healthcare, and both robotics and consumer healthcare are really starting to take off in the last 6 to 12 months. But I think the broader robotics market, in terms of a lot of the enabling technologies, are becoming much more accessible in terms of a price point that we can turn it into a consumer product. We've seen the prices around the technology that we're using drop greatly in the last 18 months. So probably a much bigger change, actually definitely a much bigger change in the last 18 months than in the 2 to 3 years before that. So I think it's a great time if you're working on a robotic product or thinking about it to really focus on getting that into the market and finding customers as soon as possible.